Hi, and welcome to my video on how to prepare for a DNP interview. I interviewed for DNP programs specifically, but if you're interviewing for master's programs or both DNP and master's programs, I think this video hopefully will be able to help you a little bit in whichever route you are going. If you are watching this video, you probably have your application has been accepted and you are preparing for your interview now. So congratulations, that's amazing. This means you are totally qualified for their program. Just now you need to knock them off their feet, if that's the term. No, sweep them off their feet. You need to sweep them off their feet with your interviewing techniques. Anyways, I'm going to be giving you some different tips on, different questions they asked me or different ways that I prepared that helped me get prepared for my interview. So the first section, what to know ahead of time. So first and foremost, just like a job interview, look up the university that you are looking to study at, know a little bit about what makes them unique or special, maybe look up if they have a mission statement or different involvement within the community or internationally, things that maybe stood out to you. Maybe you had never heard of the school before, but something about their ability to do a lot of the courses online was a big thing for you, so that could be something you talk about with the school. But just generally, I would say jot down just a few notes about the university itself, what they stand for. Next thing to know ahead of time is the difference between the DNP and the master's programs. So this was something I had to look into quite a bit before my interviews. I didn't really know. I like academia, and so I knew I wanted to go towards a terminal degree, which is the DNP program. If that's not you and you're wanting to just work as a nurse practitioner as soon as possible, then maybe a master's program is more appropriate. So this is just something to know because they did ask me about this in my interview of what being a DNP meant to me and what the difference between a DNP and a master's was, what my understanding of that was. So, you don't need to be a pro on this, and I still kind of am confused about it sometimes. But basically, so a master's program is shorter. They're usually like 2 to 3 years, whereas a DNP program is usually 3 to 4 years. DNP, like I was saying, is a terminal degree. It is a doctoral level degree. A master's program, you can work quicker as a nurse practitioner usually, but you also have the option to go back to school after that. So if you're somebody who wants to work as a nurse practitioner sooner and then maybe keep the option of going towards a DNP later, you can absolutely do that as well. So let's talk about the big similarity between the DNP and the master's is that, so I'm in a DNP program to be a family nurse practitioner. And there are people who are in master's programs to be a family nurse practitioner. So ultimately, if we both work in the clinical setting, we are equals. We are both working as family nurse practitioners. The difference in education is that the DNP is much longer and so more expensive. But there is, of course, pros that come with that. There's a big focus on leadership, on health policy, on basically wanting you to be a leader within nursing and not simply just working as an NP, but also implementing research. So that's a huge thing with the DNP is implementing research. So the sister of the DNP is kind of the PhD program, which is more about creating research. The DNP is more about implementing research. So taking the PhD students' research about, interventions for obesity, and then the DNP focuses a lot on how to read research and how to implement that within your setting. In the same way that the PhD student has a thesis, the DNP student has a DNP project, which is implementing research. So identifying a population and a problem and measuring certain outcomes. The next thing to know ahead of time is that scope of practice varies among states. states. And I didn't totally realize this before my interview, and I don't think it's something you necessarily need to know, but it might help you at certain points of your interview. It's a big thing when wanting to advocate as a nurse practitioner for full practice authority in the United States. So not all states NPs can practice in the same way. So there's certain states, and you can look this up online just by, I don't know, Googling states that have full practice authority for nurse practitioners, but just looking up and maybe seeing if your specific state does have full practice authority. And this maybe could help you in your interview when they ask you why you want to come to this university, and say the university is in a state that has full practice authority. Then you could say something about wanting to do your clinical rotations with nurses who have full practice authority. And that could be something that you're able to talk about and kind of connect with the person interviewing you. If you're from a state that does not have full practice authority, then it might be helpful to know that. And then you could say something like, I'm interested in, I heard that this, I don't know, Florida doesn't have full practice, or I don't even know, doesn't have full practice authority. And one thing I'm interested in is, as a nurse practitioner, advocating for this and being a leader within nursing and kind of fighting for that. The next thing I would recommend is ahead of time is looking through the course catalog. Most programs will have their course catalog on the website, and you can kind of look through just a brief overview of what kind of classes you'll be taking each semester. It's just helpful to know what to expect in the program, so you're not asking questions that are kind of already answered. And then the last thing to know ahead of time is about the person who is interviewing you. So oftentimes they will send you an email that you have an interview at this time with this person, and they'll actually tell you the faculty that will be interviewing you. And then on most university websites, you can look up those faculty members. And then oftentimes they have like a full CV, they have like a little blurb about what this faculty is interested in and researching, or different things that they're involved in. I think this can help you connect with the person if you do know a little bit about them ahead of time, because they have looked through your entire application, so they know about you ahead of time. So it's helpful, and maybe will help you to connect with them, just doing a quick search about them ahead of time. All right, so the next section is questions that they might ask you. So questions to prepare answers to, so you kind of have something that you want to talk about. The first is why you want to be a DNP and why you chose specifically, for me, family nurse, like to be a family nurse practitioner, or why you chose the like mental health route or women's health, whatever route you're applying for, just knowing a little bit about why you want to go in that direction. For me, I chose family nurse practitioner. I was pretty burnt out from working at the bedside, and so working in a setting where I can see people across the lifespan and kind of help them with more long-term changes, health changes, was something that was appealing to me. So just whatever it was that made you apply to this specific program in the first place, and then why, if you're doing a DNP program, why you're feeling like you want to go for that terminal degree. If you are applying for a master's program, then why you chose the master's program. Maybe it's simply that you want to work with patients as soon as possible, which is an awesome reason to be in a master's program. I am now 2 years into my DNP program, and I'm like, oh, I wish I was able to work right now. I'm like getting, starting to get learning all this stuff. I wish I could start implementing. So doing a master's before your DNP, just being able to get that experience working with people ahead of time, I think is a great reason to go for your master's. The next question they might ask is, again, like I said before, the difference between DNP and master's, which I talked about in the section beforehand. The next question, so the next question they might ask you about is your DNP project, which I touched on a little bit before, but just if you have any ideas for your DNP project or what you would want to do. So understanding what the DNP project is, like I was saying, it is kind of the equivalent to a thesis for a PhD student, but this is more implementing research. So you don't need to come into an interview knowing exactly what verbatim you want your DNP project to be, because that would be ridiculous, because they help you prepare for that. They help you start thinking about it. But I think what they're looking for is that you're interested in a specific population and you have identified some sort of problem. And you don't have to commit to this now. This isn't something where you say that and now you're committed for the next 4 years to be interested in this, but maybe just identifying something based on what you've worked in. So I worked on a neuro unit before applying for this program, where we saw a lot of patients with chronic low back pain getting surgeries. I said something about identifying a population of adults who have chronic low back pain and some sort of non-pharmacological, non-surgical interventions to help their low back pain before they're referred to a neurosurgeon or any further care. Basically, I think what would help is just identifying first of all, population, and identifying a problem. And then from there, you're not expected to know all the interventions. Like, you haven't done all this research, you just kind of know generally. So if you have those two things and kind of put them together in a way and explain it to the person interviewing you, I think that that can be helpful to come prepared with. And then lastly, it's always helpful to prepare for some situational based questions. So what they asked me about was a situation where I faced an ethical dilemma and what I did about it. Other questions that I have heard people be asked is situations where you face discrimination or unfairness, situations where you advocated for a patient, or situations where you showed leadership capabilities. So my advice for these sort of questions is, of course, you can write out specific answers to these questions and have something prepared. But oftentimes it's the question that you don't prepare for that they ask you about, and then you're like, I get so nervous. I'm so bad at these questions. But what I would advise you in hindsight is to just sort of break down the question and think about the feeling that it evokes, right? So I was so nervous when they asked me about ethical questions. Your first thing when you think about ethics is, have I ever had to take someone off a ventilator when the parent didn't want them off the ventilator? That's what we learn as ethics in nursing school. And so you think about these the most, and if that happened to you, then that's a great example. But a lot of times we don't feel like we're faced with these sort of dramatic ethical dilemmas every single day. But that feeling of an ethical dilemma is the same feeling of just feeling like you can't provide for your patients or your family in the way that you want to, right? That's the feeling that it evokes. So identifying the feeling that it evokes and then identifying what evoked that feeling, it's I've also felt like I can't provide for my patients in situations where we're understaffed, right? So that's an ethical dilemma. We're understaffed and I'm having to make game time decisions about to go see this patient first or this patient first, and that made me feel really bad because then I didn't see this patient till later and they were in a lot of pain and I just didn't like being in that situation, something like that. So identifying how it feels to you and then what situation evoked that. It doesn't have to be the most traumatic thing, and I think some of the best examples are those everyday things that nurses go through. Same thing with if they ask about your leadership capabilities, maybe you are the president of the magnet committee at your hospital, and if you are, that's great and that's a great example. But maybe you're also the type of person who doesn't really get involved in the hospital, and that's cool too, because that is definitely how I am in certain circumstances. So I think saying what's this, thinking to yourself, okay, they asked me about leadership capabilities, what does being a leader make how does that feel to me? For me, it makes me feel nervous. I think about public speaking, I think about being in front of people, and that makes me feel really nervous. And I'm when have I felt nervous? I felt nervous when I was a brand new nurse on a unit and not really knowing how to talk to patients, right? We all remember that when you go into your patient's room and you're my name is, I'm Christina and I'm your nurse. And they're you're my nurse? Are you sure? Because you just are you asking me a question or are you telling me you're nervous? You know, like it's like, you just say things and it's like, then 3 months later, you're coming in, you're so confident, you're educating your patients in a way that is informative and confident. Like that is leadership, right? Advocating for your patients to the doctors, educating your patients every single day. So no need to think of the most dramatic or impressive example. I think some of the best examples really are just that, your everyday nursing care. Okay, and our last section, questions for you to ask. This is the point of your interview. You are empowered, you've killed their questions, you have impressed them with your knowledge of the school and the DNP program, and now it's time for you to see if this program is right for you. So questions to ask first and foremost is about their clinicals. Do they help you set up clinicals? This is huge, right? Because clinicals are pretty difficult to set up, and it's really, really helpful if you have the full support of the university to help you with this. So asking if they help set up clinicals, where the students do their clinicals most often, if you are not local to that area, and helping you find clinicals. These are some really important questions to ask, even though, right, I'm in my second year now of my DNP program and we're just starting clinicals now. Although it seems like it's pretty far away, I think it's worth asking about this now, especially if you're interviewing for multiple programs. All things being equal, if one school supports you in your clinicals and another school kind of requires more from you, you're studying at a doctoral level or a master's level. Like you're studying at a really, really high level. The last thing you need is another task on your plate. Another thing you can ask about is how the school has dealt with COVID precautions. So even if it's an online program, sometimes they'll have in-person courses that you'll have to go to the campus for. In this situation, it might just be worth asking what their regulations are right now with COVID. Another question, again, the kind of support the school offers, but this time with the DNP project. So the two big things, right, is clinicals and DNP project. And you just want to know that you're going to be supported through both of these things. Another thing that's worth asking is if students work during these programs. So just asking based on the program that you're going to, if students often work. What do students do if they have a baby through school? This is something worth asking because a lot of nurse practitioner students are, late 20s, early 30s females. A lot of them are having kids. I know multiple students in my program who have had children during the program or are raising multiple children. So whatever situation kind of applies to you, this is something that I did not ask about, and here I am in my second year, and now I am 18 weeks pregnant. So I did not expect that. So even if you're not planning on having a baby, maybe it's worth asking about because you never know what's going to happen. Okay, and then a couple other things you could expand upon is if you looked up the person interviewing you, you could ask them specifically about their research. I'm not one for brown nosing or anything, so I don't think you should just ask to ask, but I think it's worth it if you see that they're researching or they're involved in some sort of groups that you're also interested in, then you could ask about that and kind of connect with the person interviewing based on that. Lastly, but most importantly, you should ask about scholarships. Maybe you are the person who has no financial troubles ever, but I think most of us are working nurses who are planning to work during school and are most definitely interested in scholarships. So asking the school about scholarships and what kind of financial assistance they might provide. Don't let their tuition scare you away from going there, because if you ask this to some of the most expensive schools, they're often the ones who often provide their students with the most financial assistance. So just go ahead and asking them about scholarships or different things you could apply to. It'll just give you a better idea of what kind of support you'll have financially during school. All right, so hopefully that helped you guys a little bit. I know you're going to rock your interview. Best of luck to all of you. If you liked the video, go ahead and like or comment any questions or comments you might have if this helped you, or any other questions you might have going further into your program, just so I know that this content helped, and then maybe I can make other things that will help you guys as well.